Thank you. Thank you very much. Have a lovely day. Good morning, viewers. Good morning, Nigeria. Welcome to Kakaki Cancer Awareness. This program is brought to you in partnership with the Commonwealth Cancer Foundation, where we spotlight the people, the stories, and actions shaping the future of the cancer prevention and care in our nation. So I am Dr. Denise Ejo, the CEO of Commonwealth Cancer Foundation. And in today's episode, we'll be turning the spotlight on a silent yet devastating challenge, bone cancer, a disease that many don't hear about until it hits close to our home. So, as we were told, the topic still remains the cost of healing, navigating bone cancer treatment in Nigeria. So, what does it take for a young person in Kano or a father in Makodi to survive bone cancer, emotionally, financially, or spiritually? Joining me this morning is a man deeply familiar with these questions, Dr. Samuel Quiz, a consultant radiation and clinical oncologist and the chief medical director of the Kano Cancer Treatment Center. Dr. Quiz, welcome to Kakaki Cancer Awareness. It's good to see you again.
Thank you, Dr. Denise. Good morning, viewers. Good morning, Nigerians. Thank you for having me on this show this morning.
It's awesome to see you. For our viewers, Dr. Quiz is not just an oncologist, he is a fierce advocate for cancer patients in northern Nigeria. From treating some of the country's most complex cancer cases to helping young children hold on to life, Dr. Quiz holds one of Nigeria's most impactful regional centers, cancer centers. I'm sure you didn't realize I knew that. We're honored to hear his insight today. Together we fight, together we win. Let's start this conversation. Let's keep going now. Let's go. So, Dr. Chris, let's start. And there are short questions today so that we can get, because of the topic, it's best to just keep them short and sweet. So let's begin this with the basics. What exactly is bone cancer and how common is it in Nigeria, especially among young people and teenagers?
All right, thank you so much. Bone cancers, just like other cancers, are abnormal growth that starts within the bone cells. The bone, just like other body tissues, it also have living tissues and it has cells. So one cell can become abnormal and then begin to invade and affect all the others, and it becomes cancer. So as against spread of cancer to the bone, is a different thing altogether. Some other cancers can spread to the bone. Commonly breast cancer, prostate cancer, lung cancer, they easily go to the bones. Now, but on its own, the bone can have a primary cancer occurring in it where it did not come from any spread. So how common is bone cancer? Globally, bone cancer is not very common. It accounts for about 0.2% of all cancers globally. So the same also follows for Nigeria, which we also account in the range of 0.5 to 1.5% of all cancers seen in Nigeria. So countries like China seems to have the higher incidence, up to 4% of their cancers. So generally speaking, bone cancers are not common. However, even for the little numbers that we have, or the small numbers that we have, the teenage or the active age group of the teenage are the highly involved. Age range between 11 to 20. So this is when they are in their developmental stages, their bones are still growing. So something probably goes wrong during the process and the bone becomes cancerous. So these are the common age group where you see a lot of the bone cancers like the osteosarcoma type, the Ewing sarcoma type. The other type, the chondrosarcoma, is largely common in the aged. That one is mostly from the cartilage of the bone. So, but like I said, generally speaking, bone cancers are common in the young age group, and it poses a lot of threat to their future, their survival, and then having to live long with cancer from starting that early. you know, that will have to take a lot to be able to keep such a young man to become a productive adult someday.
Now that leads me to the next question, because that's quite interesting, knowing that the bone cancers are mainly are more in the young. So what are therefore the emotional and financial realities facing families dealing with bone cancer?
Yes, again, cancer arguably is one of the most expensive disease to treat, right from the diagnostic process to the treatment, and then the follow-up. You know, cancer patients are being followed up for life just to check that there's no recurrence or there's no another type coming up. So emotionally, uh, I think it's one thing we really need to work on as a people or as caregivers, because imagine a young person having to lose a limb due to cancer, or you have to amputate because the cancer has gone a bit advanced. So they will need a lot of emotional and psychological support, which is one currency that seems to be lacking mostly amongst us as a people. So when they have the emotional and psychological well-being, it will enable them to lead a normal life. So in terms of the financial care, like we said, cancers are very expensive. Um, the financial needs, cancers are very expensive to treat, from the cost of radiotherapy, those that will need to be on chemotherapy. These chemo drugs can be very expensive. Some may need to be on some kind of immunotherapy. These are molecules that ranges in millions. And you ask somebody to have to take these once every 3 weeks for maybe 6 sessions or for a year, you know, it's a whole lot on an individual. So um, generally speaking, an average Nigerian will not be able to pay for a complete treatment of a bone cancer in a young person, because most of our healthcare is out of pocket. Our insurances hardly cover most of cancers. You know, very few drugs now have been approved by the insurance scheme, the NHIA, and so on. So, in terms of financing, you know, the public needs to do more, government needs to do more, especially for these young adults, by bringing up programs that can assist in treating the young children. I'm aware of some programs that have been started by the federal government through the office of the NICRAT, the National Institute for Cancer Research and Treatment, where we have what we call the Cancer Health Fund. However, this health fund covers just some specific cancers, and then children are not part of it. So we are calling, using mediums like this, that such funds should be expanded to include young adults that have any form, not just bone cancer, but other form of cancers, so that there are so many indigent young ones that do not have. However, I'm aware of centers who are doing something for children, pediatric age, like subsidizing for the treatment, making them pay a percentage, especially in place of radiotherapy. Yeah. So yes, a lot is needed in terms of financing the treatment, then emotional and then psychological care. And that's why in the cancer space, treatment, we always say that it has to be multidisciplinary. So it's an MDT approach, whereby you have the psychologist, the psychiatrist involved, the surgeon, the oncologist, the nursing care, so that it's a whole package that will enable good care for these young persons.
I was just thinking about this and just realizing that there is a need now. We have to accept that the government needs to look at how to help children, because it's like writing off the children at a very early age. It's bad enough having adults having to deal with this, but for a child, and there's no future. I've actually got one child who I need to raise enough money to get her prosthesis. Is that what you call it?
Yeah, prosthesis.
Yeah, prosthesis for her limbs. She's fought the cancer, but she's
Yes.
lost her limbs. So we got to find a way to get her. So if you ask anybody that is ready to donate to her, she needs between 3 and 6 million. just reach out to Kakaki. They'll get back to us. Thank you very much. And let me go. So I'm going to ask my last question, and I want this one to look at it as we're looking at this. Here's a big question. How can ordinary Nigerians, our youth, media houses, religious communities, neighbors, get involved in reducing this burden and raising awareness about bone cancer?
All right. A lot of people present very late with cancers, especially of the bone, because of ignorance or lack of awareness. So one thing the general public can do, especially those that have had the privilege of listening to this, is to create awareness and spread the news that if you see any swelling around a bone, it's not just an ordinary swelling, get to the hospital, let it be checked properly. If a child is suddenly having pain on any part of the body or the bones, and it's being persistent, please do not hesitate and keep at home or keep taking those pain reliefs, like that. If suddenly a small fall, you have a fracture, it's not just going to um, the traditionalists to just fix it. It probably is beyond just an ordinary fracture. Because a bone that is cancerous is already fragile, is friable. So you just see a small fall that shouldn't cause anything, and suddenly there's a fracture. It should be evaluated further. So we're asking, get aware of these possible signs and symptoms, and then also spread. If you see somebody having any such, please advise and spread the good news. And then in terms of this financial support, you can reach out to so many NGOs like yours and make your contributions, or through the media channels that can have the means of reaching out for this purpose. A lot really need that support. And those in the government space and policy makers can also come up with policies that will be favorable in managing those with cancers, especially the young group that we're looking at, by the ways of subsidizing um, some of this treatment, by way of including this age group into the National Cancer Fund so that they can also benefit. And then by getting the insurance companies, the NHIA, include most of this management, especially for this age group, into the scheme. I don't know how Niger Republic did theirs, but I'm reliably informed. I'm aware that treating cancer for women and children is free in Niger, neighboring Niger Republic. So from the diagnosis to your surgery to chemotherapy to the cost of you staying in the hospital, even including feeding you in the hospital. So I think we can replicate something similar in Nigeria, because these are a vulnerable group of people that have cancers that involve them. And the government, through the Federal Ministry of Health, can come up with some kind of funding that can cover for such. If Nigeria can do it, I believe we can do. Let's catch up for the vulnerable amongst us. So at least there will be
Actually,
some hope for them in the future.
I actually like the way you said that, and honestly, I think that it's fantastic to hear that at least we've got an example next door that is a neighborhood, the neighboring country. So let's round up now, and I want to say a very big thank you. Together we fight, together we win. Thank you very, very much for joining me. You hit some very good nails, so I'm glad. I'm glad. So thank you, Dr. Case. That was deeply insightful, and I know many of our viewers are walking away both sobered and strengthened. To every viewer watching, maybe you know someone who's battling bone cancer or a child who's lost a limb to this disease. Remember, your voice can be part of their healing. Some support matters, awareness matters. Early detection saves lives. Advocacy saves the future. We must not walk in silence anymore. Together we rise. Together we fight. Together we win. Let's continue to use this. And follow us on all our social media handles, Commode Cancer Foundation. This will be on our Commode Cancer page at some point in the next few days. And let's share this message. Let's keep this conversation going. Help everybody. Children, remember, seems to be a children thing. Doc, it's very kind of you to have given us your time. Thank you for joining us, and thank you for your words.
Thank you.
Thank you. And thank you, viewers, for joining us on Kakaki Cancer Awareness, brought to you proudly by. Our message is very clear. Together we'll fight, together we win.